Generally speaking, there are two schools of thought when it comes to how to manage a flare-up when someone's undergoing treatment for a chronic infection. Some clinicians feel that if a patient's not flaring from their antimicrobial treatment, they are not being treated aggressively enough, and that flaring or having a Herxheimer reaction, or herxing as it's called, is just kind of the cost of doing business for treating chronic infections. And then other clinicians, and this is the group that I'm in, feel that if a patient is flaring during a treatment, it's an indication that the treatment is too aggressive, that we are killing things off too quickly. Of course, we want everybody to get better ASAP, but we don't want that to happen at the expense of someone suffering, and quite frankly, suffering unnecessarily. The analogy or the description that I give to my patients is that if they're treating too aggressively and they're flaring, sure, you might be taking 3 steps forward at a time, but you're going to be taking 2 steps backwards trying to recover from all that inflammatory aftermath of treating too aggressively. I think it's much better to take 1 step forward at a time, or maybe 1.5 steps forward at a time, and not be flaring, to make the process more tolerable, more comfortable, and ultimately, in my opinion, more efficient in the grand scheme of things. So I am proud to say that I am an anti-herxer, and I try to keep the flare-ups to a minimum for my patients.